unimaginable to a generation which thought it was immune to the usual cycle of pandemics. A 4,000-bed hospital is taking shape in London's vast XL Centre as the NHS gears up its response to this modern-day pandemic. Appreciation for the workers building the temporary Nightingale Hospital, which will form a vital front in the fight against coronavirus.
What you see here is a mass mobilisation taking place right across the country, but also at these new Nightingale hospitals. This has been an extraordinary team effort.
Preparations on the front line as the government's chief scientific advisor delivered some potentially good news. Sir Patrick Vallance said the UK lockdown is working as he published a graph which showed that the use of cars, national rail and in London tubes and buses has fallen dramatically.
The measures that have been taken are having a very big effect on contacts, and I showed you the data on transport. You can see dramatic reductions in the amount of transport being used. You see dramatic reductions in footfall. We know, of course, that things like restaurants and pubs, which are places where people aggregate, have been closed.
Hospital admissions are rising by roughly 1,000 a day, but Sir Patrick said they are doing so at a constant rate, which suggests there is not a fast acceleration.
It tells you that actually this is a bit more stable than it has been. I do expect that number to continue. I expect the number of people coming every day to be about that. It may go up a little bit. Then in 2 or 3 weeks, you would expect that to stabilise and then to start to go down a bit. And the numbers as projected are designed, as the Chief Medical Officer has said, to keep this below the ICU capacity.
And then a bold prediction, the R value, which describes the number of people on average infected by a person with the virus, may be heading downwards.
The idea is to get that number below 1, at which point the epidemic stops and starts to go down. On the basis of the contacts, you would expect that R value now, in terms of the early phases of transmission in the community, to be coming down or below 1.
A cautiously upbeat assessment from one of the most senior government scientists at the heart of the battle against coronavirus. But Sir Patrick Vallance warned of much tougher days ahead and no time frame for when restrictions on people's movements may be eased.
I had a message from
a former health secretary who's been critical of the government's response sees tentative signs of hope.
You have to be incredibly impressed with the mobilisation we've seen on the NHS side, the 4 field hospitals, the 33,000 beds that have been released, the 730,000 volunteers, the requisitioning of beds in the independent sector. There has been nothing like this in our lifetimes. And I think if you combine what the NHS has done on the supply side, as it were, for beds, with the very draconian social distancing measures that have begun to bite in the last week, you know, that light at the end of the tunnel is not as impossible as it may have felt a few days ago.
A dramatic illustration of the scale of the UK's response to the coronavirus, but a warning too that we are in the very early stages of dealing with this pandemic.
Nick Watt there, and he joins me now with some more of the numbers of the day. Nick, let's start with those who've died. Is there any direction of travel here yet?
Well, they're saying it's obviously a sad but expected direction of travel. So, as you say, the tragic human toll. So the Department of Health announced that as of 5 p.m. yesterday, of those who've been hospitalised, 1,408 have died, and that is a 180 increase on the day before. Sad, but in line with expectations. Now, you'll remember last week that the numbers moved around a bit after we reported that the government was changing the time frame in which it was releasing those numbers to bring the 4 parts of the UK all absolutely on the same line. There's going to be change again, because from tomorrow, the Office for National Statistics is going to be releasing weekly statistics on deaths, and it will take into account deaths outside hospitals. So again, we can expect an increase.
Those numbers have fallen 2 nights running. People will be looking for optimism there, but presumably they'll tell us too early to see any sort of pattern in that. Is that right?
Yes, that's right. I mean, it was obviously quite significant interventions from Sir Patrick Vallance today, but he was saying, you know, steady as you go, and it will take some time to actually see the lockdown measures having an impact on the death rates.
And Nick, where are we on the testing? Because there have been a lot of aspirations here which haven't always matched to the numbers of the testing done on the day.
Well, I think it would be fair to say that we've had mixed messages from the government on this over the last 36 hours. So yesterday, Michael Gove stated with great confidence that there were 10,000 tests a day. Then Helen Whately, the health minister, on the Today programme this morning said that it was more like 7,000. We got a rebuke from Number 10 saying those ministers were just speaking to figures provided by Public Health England. But we also got some clarity from Number 10. So what they said is that the UK can conduct 10,949 tests a day. And then they said that in the 24 hours up to 9 a.m. on Saturday, 9,114 tests had been conducted on around 7,000 people. Now, the reason for that discrepancy is that there are a number of medical staff who need to have multiple tests performed on them. But clearly, this is a matter of deep sensitivity for the government. At that daily press conference, the Foreign Secretary, Dominic Raab, read very carefully from a pre-prepared statement when Beth Rigby of Sky News said to him, "Why on earth are we lagging so far behind South Korea and Germany?" And looking very carefully at his notes, he said, "We're operating on multiple fronts, and yes, we are trying to buy a lot of testing kit."
Nick, thanks very much indeed. Well, joining us now, Director of the Centre for Behaviour Change at UCL, Susan Michie, Labour's Shadow Health Secretary John Ashworth from his constituency in Leicester, and the President of the Doctors Association, Dr Sammy Batt-Rawden. Thanks to you all for joining us this evening. John, I'm just going to start with you on where you read the government tonight. We don't want to overplay this, but it has been a good day for that strategy, hasn't it?
Well, it does sound very hopeful, and I agree with Jeremy Hunt and what he said in your package a few moments ago. We all hope to God that the social distancing measures that have been implemented are beginning to have an effect, an impact. But there are still questions, though, about why we are not scaling up testing to the levels that we need. We know the World Health Organization has urged the world to test. And they've also said that unless you're testing, you don't know the prevalence of the virus in the wider community. So one of the questions I want the government to answer, or perhaps Sir Patrick, the Chief Scientific Advisor, to answer is, how can they offer the greater degree of certainty and hope that they've offered us today if we don't have a better understanding of the prevalence of the virus in the wider community? Because unless we're testing at levels like Germany are, which is 500,000, we're not going to know where the virus hotspots are in the community. We were promised 10,000 tests a day, I think, on March the 11th. Well, we're still not at 70,000 a week. And this is even before we get to the long-term ambition of 25,000 a day. So we just need greater clarity from the government on that front.
Is that clarity coming to you, Dr Batt-Rawden? Are you being told whether this is a strategy or whether they just lack the sufficient means and capacity to test? Because we don't understand that.
To be honest, we don't understand it either, Emily. We've had a lot of confused messaging from this government. A couple of weeks ago, frontline NHS staff were promised testing to get those of us back who are currently self-isolating back to the front lines, back to work. There was absolutely no clarity at that time about how much of this testing being ramping up was going to be allocated to frontline staff, if any of it. Then on Friday, we heard again that, yes, frontline staff will be tested, but again, no meat on the bone to that announcement at all. And then today, we finally had some hope in that we've heard NHS England have asked trusts to identify staff who are at home, who could be tested, and then brought back to work if their tests are negative. But the numbers that we've heard are that 15% of those tests for NHS trusts should be allocated to staff that are at home. Now, we know today from the Royal College of Physicians that 25% of doctors are currently at home, either unwell or self-isolating. There are over 150,000 doctors in the UK. This just doesn't add up to us at all.
So let me just ask you, because we've seen the Excel Centre, now the Nightingale Hospital, pulled out of the hat, it seems, with remarkable speed and efficiency. We've seen the social distancing measures and the graphs from Patrick Vallance today showing the effect they were having. Do you believe that you are back from the brink on this one, even with those numbers of staff down?
So my colleagues have been working on the Excel Centre, NHS Nightingale, in London. It's an incredible feat. And in fact, I've just volunteered to work there myself as an intensive care doctor. But I'll be really honest with you, things are really tough on the front line right now. My colleagues in London are, I'll be honest, they're completely broken. We're seeing a lot of patients get sick. A lot of patients get sick very, very quickly and starting to encroach on our critical care capacity. So, yes, the effort has been phenomenal, but we haven't quite reached our peak. I suspect the worst is yet to come. And whilst all of us want that light at the end of the tunnel, I'm worried.
Susan Michie, I'm trying to work out whether we are still expecting that peak in 2 weeks' time to be as bad as they imagined it would be at the beginning of this. Do you think there is a momentum towards a new direction of travel now in terms of how we've got on top of this? Or when you listen to Dr. Batt-Rawden, it sounds like there are still many people on their knees.
Well, if I could come at it from a slightly different angle, and that is the public's response to the advice to stay at home and the extent to which that is likely to continue over the next few weeks. It's been magnificent over this last week, which is excellent. But we know from the evidence that the longer that this sort of quarantining or isolation goes on, the more difficult it becomes. And there are two sets of problems. One is psychological problems of frustration, anger, boredom, depression. For those living on their own, loneliness. And for those living with other people, especially in crowded conditions, relationship problems and tensions. And we've already been hearing about domestic abuse, sadly, across several countries. And we know that these kind of problems get worse as time goes on. And we also know that these kind of problems are worse for those on lower income and with financial insecurities. So I think that in this situation, the government must plan ahead. You know, we can look at the literature, look at the evidence, see what the likely problems are and plan to try and prevent this so that we keep the public with us and ensure that we carry on.
But just let me ask you what that means then. Would you prefer not to have the government saying this could last up to 6 months because it will depress people and make them feel that there is no way out? Or would you prefer people to be told that, even if it's going to be the harsh reality?
We know from the evidence that transparent, honest, open communication is by far and away the best. And people like certainty where there is certainty, but a good explanation as to if there's not certainty. And I think the idea of, as we heard yesterday, of saying 3 weeks and then it's going to be reviewed and then we'll see what happens for the next stage. But we do know that this is only week one. You know, there'll be week 2, week 3, possibly several weeks after that. My point that I'm making is there are likely to be strains and stresses. People are living in very different kinds of conditions. And the government should, at this point, be ensuring, for example, that 5 million self-employed people don't have to wait till June for cash to feed their children. And they should be ensuring now that every single household has got enough social support and material support to keep them going through this period and not be on the back foot and being catch up when the problems arise, because you look at the evidence and they're predictable.
John Ashworth, Susan Michie's raised some very tangible points there. I just want to ask you what you would do in terms of momentum, in terms of the messaging. Do you think people need to hear positive news like this, or do you think you lose people as soon as you say that social distancing is already working?
No, I think it's entirely incumbent upon ministers and officials to be entirely clear and honest with people. And what Susan was saying was absolutely spot on, which is why I come back to my original point. unless we have extensive testing in the community, unless we really ramp this testing up now, we'll have to be in lockdown for much longer, or we'll simply go through cycles of lockdown. Because lockdown in itself is a blunt tool to defeat this virus. We have to combine it with an extensive testing programme in the community like Germany are doing. And look, the government need to explain to us why we are not ramping up, why are we not doing 500,000 tests a week like Germany. The speculation is because of bottlenecks in global supply of the chemicals that are involved, the so-called reagents. If that's the case, the government just needs to come out and explain it to us. Others are asking, is it because they didn't order enough kits early enough? I mean, we don't know. The government have to give us this absolute clarity now as to why our testing capacity is not on a level with some other European nations. But this is so important that we ramp up testing. That is how we escape this lockdown in the end.
Thank you all very much indeed. Thank you.